In this video, I'm summarizing Huberman's talk with Peter Attia, what they said about 4 leading causes of death and how they could be prevented. The leading causes of death are 1. Cardiovascular disease, 2. Cancer, 3. Neurodegenerative diseases like Alzheimer's, and 4. Metabolic diseases like type 2 diabetes. These are what Attia refers to as the 4 horsemen of chronic disease. The main type of cardiovascular disease is atherosclerosis, or plaque buildup in the arteries, which leads to heart attacks and strokes. Fortunately, we know a lot about how to prevent plaque buildup in the arteries. And if you arm yourself with the knowledge, you don't have to die from this. It comes down to 3 main things. 1. Avoiding smoking. 2. Managing blood pressure. And 3. Controlling LDL cholesterol. High blood pressure, or hypertension, increases the risk of both strokes and heart attacks. Think of it like a pipe. When it is clogged, the pressure goes up. When the arteries are narrowed by plaque buildup or atherosclerosis, blood pressure increases. High blood pressure can cause small blood vessels in the brain to rupture and bleed, or it can cause a heart attack. Attia recalls a story from the time he was attending medical school. The professor asked them what are the early signs of a heart attack. A student said, pain in the chest, the feeling of tightness in the chest. And the professor said, none of these. When you feel it, it is happening. And there's a 50% chance of death the very first time. You don't feel a heart attack coming a few days or even a few hours before it. That's why monitoring blood pressure is very important. But here is the good news. It's easy to monitor and it is fixable. Your blood pressure needs to be within the 120/80 range. You can get a blood pressure cuff for $40 and do it at home. It's convenient and maybe even better than the reading in the doctor's office, because you should be sitting still for 5 minutes before the measurement. But in the doctor's office, it's usually rushed. Measure your blood pressure twice a day, morning and afternoon, for 2 weeks. If your numbers are fine, you can revisit this next year. If they are too high, our goal is to see how much we can lower it naturally before considering medication. These are the things that can fix it for many people. Focus on getting the sleep right, losing 10 pounds of weight, and exercising every day with low-intensity cardio for a total of 3 to 4 hours a week. If these steps didn't solve the problem, talk with your doctor. Gladly, the medication nowadays are so much better than those in the past. Attia refers to exercise as the most powerful drug for longevity. If you want to know more about the exercises that Attia recommends, watch part 2 of this summary on my channel, and don't forget to subscribe. Now cholesterol. Let me simplify this so you get the big picture. It's important to understand that cholesterol is needed in the body by different organs, and it is made in every cell of the body. So, depending on where it is needed the most, it should get there. But it needs a carrier to move, because cholesterol is made of fat and blood is water-based, and fat and water cannot mix. So cholesterol needs a carrier to move through the bloodstream and to get to the other organs. There are 2 types of carriers, ApoAs and ApoBs. ApoA is found in HDL and ApoB is found in LDL. The problem is that most of the time we are testing LDL. Attia says that this is not so accurate and they should be testing for ApoB levels instead. There is no ambiguity that ApoB is a strong predictor of heart attack and is causally related to plaque buildup, so testing for it and controlling it is crucial for preventing heart attack. But in the medical offices, they ignore it in the people below 40 years of age, which in Attia's opinion, it is wrong, because the earlier you start managing ApoB, the less damage it has occurred and the less aggressive treatment you need. You can lower ApoB by fixing insulin resistance. Elevated triglycerides are a hallmark of insulin resistance, and Attia considers anything over 100 to be elevated, even though many labs set the threshold at 150. Ideally, your triglyceride levels should be at or below your HDL cholesterol levels. Carbohydrate restriction is one way to lower your triglycerides. Exercise is less effective at changing lipid profiles, but it can improve insulin sensitivity. The second horseman of death is cancer. 1 in 3 people have a chance of developing it, and a 1 in 6 chance will die from it. Prostate and colon cancers are highly treatable if caught early. That's why regular screening is essential. Less than 5% of cancers come from inherited genetic mutations. The majority are caused by somatic or acquired mutations, driven by factors like smoking and obesity. About 2/3 of cancers have a very strong tie to obesity. In Atiya's words, if your waist circumference is more than 50% of your height, it's a sign of obesity, which is linked to higher risk of cancer. This measure is more accurate than BMI because BMI only takes the ratio of weight to height and it doesn't consider if the weight is mainly muscle mass or fat. Screening for cancer is important, but keep 2 things in mind. First, radiation exposure from the scans that delivers high doses of radiation, like CT scans. And 2, even though MRI scans are safer, but they don't have that accuracy, and 25% of the time that they identify certain things, it's not cancer, and it requires more investigation. Family history is a key factor in assessing cancer risk. Genetic screening for specific conditions like ApoE for Alzheimer's can be useful. Atiya recommends colon cancer screening starting no later than age 40, because colon cancer is the 3rd leading causes of cancer deaths, but it is 100% preventable with early detection. The third horseman is Alzheimer's disease, and is the most common form of dementia. While some genes are deterministic for Alzheimer's, they are rare and account for only about 1% of cases. These are people that are usually getting Alzheimer's disease in their 50s. For the rest of us, lifestyle factors are the most important. Things like good sleep, lower LDL cholesterol and ApoB, and managing diabetes are all important factors, and also regular exercise. If you can only spend 3 hours of a week exercising, Atiya recommends a mix of low-intensity cardio, strength training, and high-intensity interval training. Atiya warns that unfortunately, as of today, we don't have a promising treatment to offer for dementia and neurodegenerative diseases like Parkinson's. So avoiding them is the first, second, and third priority on the list. The higher your cognitive reserve and the higher your movement reserve, the more resilient you are to these conditions. The fourth horseman is the spectrum of metabolic diseases, and it is primarily a consequence of overnutrition. This is what Atiya refers to as the crisis of abundance in the chapter 6 of his book Outlive. Overeating is really the driving factor of insulin resistance, and insulin resistance leads to everything from fatty liver to type 2 diabetes, and it increases your risk of other horsemen by 25 to 50%. So insulin resistance is really the gasoline on fire of other diseases. Next up, watch the summary video I have created on exercises that Atiya recommends as the pillars of longevity. Thanks for watching, and I see you there.